At GBMC, we've spoken to many groups about the kinds of things that we've done from an innovation standpoint. And our whole philosophy is built upon the quadruple aim. And I'm sure you're all familiar with that, that we're looking for better health, better care, less cost, and for us, more joy. And we've built our entire company around that whole philosophy. And I'm going to show you in a couple minutes what is important to your clients, which is getting access, saving money, and having high quality care. And that's exactly what we provide at GBMC. So rather than tell you a big story, I thought I would just show you some results. Now, as background, GBMC has been a participant in the Medicare Shared Savings Program. A lot of you, I'm sure, are familiar with the ACA and the fact that with Obamacare, there's a new model in place that organizations can take advantage of, where there's an opportunity to share in any gains that we get through either cost savings and increases in quality for the Medicare patients. And that's the most reliable data that we have. So that's why I'm going to focus on the Medicare Shared Savings Program and Medicare data, because the commercial data that we get out in the field is not very reliable right now. But this will give you an idea of how we treat patients and how we're going to save your clients money in the long term. Here's our first graph. And to orient you to this graph, GBMC is the blue line. This is total cost of care in taking care of the Medicare population. Those of you who work in the commercial market are going to look at these numbers and say, that's outrageous. Those numbers look really high. But for the Medicare population, the average is about $13,000 per member per year in care. As you can see, we started our journey at about $12,600. And over the past now 3 years, we have lowered that cost of care by 11%. So where you're seeing increases in the market and your clients are getting increases from Care First, from Aetna, from Cigna, we've actually dropped the cost of care with the toughest population to manage, because the Medicare population is by far the toughest. Now, the red line we show is a group that we are compared to nationally, because as an ACO, we are compared to 150 other companies that look like us all around the country. And you can see what's happened with their cost. Their cost has actually gone up by 1.3%. Now it's much lower than what we have, because in Maryland, and if you're familiar with how the waiver works here in Maryland, hospital prices are much more expensive in Maryland than they are in the rest of the country. The reason being that our prices include things like bad debts, education costs, security costs, capital costs that aren't factored in to the rest of the country. That's what that big delta is about. But this is just to show you, even though the rest of the country is going up, we've been very successful in managing those costs down. And I'm going to tell you, as I go through each of these slides, what we did in order to affect that. Okay, here's our inpatient costs. As you're probably aware, inpatient costs around the country have been increasing pretty dramatically on the commercial side. And again, we've shown a 22% decrease in inpatient cost over the years, despite the fact that hospitals are all getting rate increases. And at GBMC, we have the lowest charges and lowest prices to treat inpatients. So as we move more and more business to GBMC, we are going to save your clients money. And save it pretty dramatically. Now, how we've been able to do this, the biggest factor to this is the fact that we've been able to keep people out of the hospital. And this graph shows that we've been able to drop admissions to the hospital by 29% over the past 3 years. And we've done that in a coordinated care method. We employ approximately 14 care managers at GBMC that are in our primary care offices. So if you come in with a chronic disease and you see our primary care doctors, you're going to be assigned either a nurse or a care coordinator to work with you to make sure that you stay on your meds, that you get your exercise, that you lead a healthy lifestyle. And because of that, we've been able to keep people out of the hospital and have done obviously an outstanding job at it. Now nationally, Medicare has seen a decrease of about 8%. But still, we've beaten that number by over 20%. Again, through our care management and also through our care coordination between the care that you get in the hospital and the handoff back to the PCPs. If one of your clients has an employee that is an inpatient at GBMC. When they leave our hospital, they're going to leave with a care plan on how to make sure that they stay on their regimen, and there's a communication that occurs back to their primary care physician. So that constant loop is in place to make sure that we keep people healthy and keep them out of the hospital. Believe it or not, we want to keep people out of the hospital. I know that's heresy for hospitals to say that, but with our reimbursement system, it actually benefits us to keep people out. ED visits. Here's the highest expenditure that we have in healthcare outside of inpatient stays. The average is about $700 every time one of your clients has an employee that comes into a hospital ED. So we've had a concerted effort to keep people out of the emergency rooms. And the way we've done that is in all of our primary care offices, we've extended hours. So no longer are we open just 9 to 4:30 and then send you to the ER after that. Most of our offices are open 12 hours a day and open on the weekends. As a matter of fact, our office in Owings Mills is now open on Sundays, and other offices are open on Sundays, so that we can get patients directly in to see their PCP, where their records are, where they have their relationship, and keep them out of the ED. In addition, in our primary care offices, we hold 30% of the visits open, so they're not scheduled. So if you wake up in the morning and you really need to see a doctor, we'll get you in at one of our facilities. If you can't see your exact doctor, we'll get you into one of our other offices because we're all in the same record. All of our primary care doctors have the same information system. So if you see Dr. Smith today, but Dr. Smith is busy and you can go see Dr. Jones will have all of your records and make sure that the coordination then occurs with Dr. Smith when Dr. Smith's back to work. That's how we're keeping people out of the emergency room. As you can see, we've decreased 13% over this 3-year period, while the rest of the country is actually going up, and emergency rooms are getting busier. Here is probably the biggest cost to the Medicare program. These are patients that get readmitted within 30 days. And the good news is that we can benchmark pretty well where all the hospitals in Maryland sit, and we are the best at lowering the readmission rate. And again, we've done that through a lot of different mechanisms. Our care management program keeps people out of the hospital from coming back. The handoff back to the primary care physician. And we actually have somebody stationed in the emergency room that works with patients when they do come into the ER to see if we can get them into the right level of care to avoid that admission. So, I've shown you some results, and you can see everything is going in the right direction. And you can assume that this also occurs on the commercial side. So again, as your clients are seeing rate increases, and have been for years, we can promise you that you're going to continue to see these decreases in the way that we manage care, because we actually have changed the model and the way that we manage care with our patients. So hopefully your clients will be excited with this new product. And the other fellows are going to tell you a little bit about the mechanics of it, but this is the underlying economics to it. And as you can see, it works.